Well, back with Dr. Bondarev from Van Nuys in California. Dr. Bondarev, you have told us a little bit about, the philosophy of your practice and things, and how you became a chiropractor. Dr. Bondarev, tell me, what is the main goal of your practice? Are people with heavy pain coming to you, or kind of like focus a little bit what, the big picture you already told me? What's the main goal of your practice as a doctor here?
First of all, we try to help people, and we try to make them understand the very important concept. The pain itself is highly unpleasant experience, and it's in 21st century, definitely. There's no need to experience pain, and that's why we have anesthesiologists, and we have orthopedic surgeons with a number of injections and procedures and whatever it is. And I'm very respectful to that. What people do not understand, that pain in itself is not a problem, except certain very rare conditions like so-called sympathetic dystrophy syndrome, when pain in itself becomes a problem. But in majority of cases, pain is a God-given tool to us to realize there is something wrong in the body. So instead of treating the pain, we're treating problem. We try to find the source of this pain. Of course, definitely I work with a number of anesthesiologists and orthopedic surgeons, and whenever the pain is intolerable, I refer it to them. But my patients, majority of them, understand that the major goal and final purpose is not to decrease the pain. In my website, I come up with a comparison of this situation to the firefighter who came to your house to fight the fire, but instead disarming the alarm, and primarily actually giving the chance of the house to burn to the ground. And that's why we try to make people understand it. That pain is something that we have to treat with the highest, utmost respect, as a signal, as a system letting us know what's going on. Sometimes in my practice there are so many patients, they come here, they say, yes, I have a problem for many years, but thank God I went to a certain office and they did an injection and I felt so good for 6 months. The question arises, whether the problem itself was addressed. Most probably not, just simply the pain was taken away. Unfortunately, the process of degeneration and destruction of the structure is still going on. You simply do not feel it, you do not know about it. And that's a major tragedy, I would say, of the modern medicine, when people misled in a major comprehension of the pain as something so important and vital in your life.
Right, because it's like you mentioned the fire example. It's almost like when your engine light comes on and you put a piece of paper over it so you don't see it anymore, because
exactly.
that's all what bothers you at that moment. And when people don't fix where the cause of the pain, yes, they may not have pain, so that's for that moment fine, and sometimes there's a reason to do that the pain goes away, while however never to forget to also fix the cause, because if they don't fix the cause, not only that part is heavily affected, since the body works in such a synergy. I mean, there literally, I think, is no body part which doesn't affect many other body parts. One body part, gets the flow stack of the blood and does the nutrition and does the oxygen and whatever it may be. And next thing you know is the liver or the kidney or the stomach or the brain, kind of deteriorates. And nobody will see it because if nobody has nothing to do with my shoulder, well, why would it? Shoulder and kidney. But the truth is, it probably does to a very high degree. Not necessarily what I say is completely correct at this moment, but in some shape and form, the body is a domino effect, all the time. So that's why it is so important to fix the cause. Now, how do you go about fixing that cause?
First of all, I like very much your allegory and comparison of the situation to the check engine sign. That's exactly what's going on. Let me give you an example first. Patient has certain pain in the shoulder. His family physician says, they react immediately. If it's something bone or joint or something, the final authority is orthopedic surgeon. Immediately referral to orthopedic surgeon without realizing that orthopedic guy is a surgeon first of all. But anyways, the patient is referred with a shoulder pain. Orthopedic surgeon does some examination, of course, sometimes MRI, sometimes CT scan, X-ray, bone scan, whatever it is. Then they say, all right, we'll do injection. They do injection, patient is happy for a while, then pain comes back. Patient is surprised. How come? Sometimes it does not come back when body managed to compensate for this condition, sometimes not. Sometimes I try to bring example to these kind of patients. I try to bring other kind of example. For example, you go with the obvious signs of appendicitis, let's say. You come to surgeon. You say, doctor, what's wrong with me? He says, most probably you have appendicitis.
Explain that word in English for people like me who don't know what it is.
Appendix, the very famous appendix.
The one in your stomach.
Yeah,
that little 2-inch things which.
Yeah.
Okay, I got it.
Exactly. Let's say patient came with an inflamed appendix, if it's more clear to read. And imagine the situation. Surgeon says, all right, you have appendicitis, my friend. We're going to prescribe you painkillers. Can you imagine the reaction of the patient? Just, what, you're not going to operate? You're not going to remove the cause of this condition? You let me go into peritonitis and all that? No, we're just going to decrease the pain. We're going to take it under control. You're not going to feel anything. Or imagine another thing. A patient came with a significantly decayed tooth to a dentist, expecting help.
That's a good one.
Imagine the situation. You have very serious decay, and there is very high chance.
Inflammation, your root is rotting away.
Yeah, the doctor, what we're going to do? I'm going to just give you some anesthesia and go home. Probably patient will either be in a shock, or he will say that this dentist is insane. Now imagine the situation. Patient came with a significant pain in the spine, in a shoulder, in an elbow. And the doctor says, you do have arthritis. Doctor, what are you going to do? We're going to give you a pain shot. We're going to take the pain down. I think this example describes what's going on in the modern medicine with a musculoskeletal in a musculoskeletal field, or let's make it simple, with the bones, with the muscles, with all that stuff. Sometimes orthopedic surgeons refer patient to the physical therapy. Now, physical therapy starts. The problem is still there. Majority of physical therapy start with the vigorous exercises. Again, imagine the situation. Somebody came with a broken arm, and physical therapist says, okay, you have a broken arm, let's start exercise. Can you imagine what's going to happen with this patient? But the situation with the regular osteoarthritis, or more correctly speaking, osteoarthritis, is pretty much the same. It's pretty much the same. There is a serious mechanical problem, and this problem needs to be addressed. And it can be addressed, unfortunately, with nothing else but manual therapy. You can call it chiropractic, you can call it osteopathy, you can call it bone setting, you can call it whatever you want. But essentially,
physical therapy, whatever you exercise, you can call it whatever you want.
No. Physical therapy is primarily rehabilitation. First, you have to fix the fracture and then do exercises. But situation with the regular sufferers of neck, back, shoulder pain is pretty much the same. You have to structurally and functionally fix the area, and then you can go into rehabilitation. Exercise is a part of rehab. Unfortunately, it happens vice versa. People with unfixed problems start getting treatment that was appropriate and is appropriate on the later stages. What we're trying to do here, first of all, educate patient that absence of pain, if it's artificial absence of pain, meaning through medication, through injections and these kind of things, does not mean the absence of problem. The problem is still there. And the problem needs to be addressed, and then all the necessary rehabilitation is appropriate, and we're happy to provide it even in my office. We have massage therapy, we have different kind of physical therapy modalities, like electric muscle stimulation, like ultrasound, like paraffin bath, and all that necessary stuff. But again, everything is appropriate at appropriate stage. That's pretty much the philosophy of the office, and that's what we do.
So basically, yes, people come in with pain, and obviously you will work on getting the pain away, but your main